Hi, I'm Dr. Linath Lim. I'm one of the hospitalists working in Central California.
This is Cambodian-American medical doctor Linath Lim. She found herself on the front lines when the coronavirus hit her city in Fresno, California.
I work mainly in the emergency room in one of the level 1 trauma center in Central California. I've seen a lot of patients coming through with COVID. This disease is real and it's deadly.
Her brother says the 58-year-old physician began experiencing COVID symptoms in the days leading up to January 18. That is when he found her dead in the home where she lived alone.
Dr. Lina នឹងគាត់គេទេមកគេថាសូមឲ្យអ្នកឯងទៅឆែកមើល Dr. Lina មកផ្លែត
Dr. Linath's colleague called me and asked me to check up on her because she had missed her shift and hadn't returned their call. When I got there, I knocked on the door really hard, but no one answered. I then used my key to get in and disable the alarm. I knew immediately that she had already passed away when I saw her lying on the sofa, seemingly not breathing.
ព្រោះអីខ្ញុំមើលឃើញតែគាត់គេងតម្រេកនៅលើសាឡុងហើយដូចថាគ្មានដង្ហើមអីទៀតទេ
An autopsy ordered by police found the coronavirus caused Dr. Lim's death. 5 weeks before Linath Lim's passing, the U.S. Food and Drug Administration authorized the first emergency use of the Pfizer-BioNTech vaccine for selected healthcare workers and elderly people. But she decided not to take it, telling her colleagues that her body reacted severely to even normal flu shots.
បុគ្គលខ្លះអ្នកខ្លះមាន allergy នឹងថ្នាំដូចជាចាក់គាត់ចោលបាន
Some individuals may be allergic to the vaccines. This group will not benefit from the vaccines. She might have been one of them. But think about it. Even though she was at high risk, she was still committed to her obligation to help COVID patients.
Linath Lim and her family fled Cambodia because of the Khmer Rouge, a communist regime that killed some 1.7 million in the late 1970s. She arrived in America in 1982 at the age of 20, and 2 decades later, she became one of the first Cambodian-American survivors of the killing fields to have graduated from a U.S. medical school.
ពេលមកដល់មុនដំបូងមានការទុក្ខវេទនាមែនទែនព្រោះអីដូចថាទី1យើងមិនដឹងប្រពៃណីយើងមិនដឹងថាគេ
When we first got here, it was really difficult because we didn't know the culture, speak the language, and understand the living system here.
ដូចថាប្រព័ន្ធនៅណាប្រព័ន្ធរស់នៅនៅណាគឺពិបាក
Linath Lim, who never married, started practicing internal medicine in 1996.
ពេលគាត់ទទួលបានប្រាក់ខែមុនដំបូងបងអត់គឺថាប្រាក់ខែផ្សាយលើកទី1ហ្នឹងវារៀងធំបន្តិច
When she got her first paycheck, which was quite large as a medical doctor, she donated all of it to the church that we always went to when we were in college. In 1997, she began using her own money to buy medicines or gather tons of medicines from wherever she could find and then regularly brought them to Cambodia by herself.
យកប្រមូលថ្នាំពេទ្យដោយរាប់តោនកាលហ្នឹងមុនដំបូងយកទៅស្រុកខ្មែរផ្ទាល់ខ្លួនហ្មង
So I want to take this opportunity to thank the community made this organization very successful.
One of the earliest members of Chapa, or Cambodian Health Professionals Association of America, Dr. Linath Lim, was dedicated to giving back to her communities, both in Cambodia and America.
ទោះបីខ្លួនគាត់បណ្ដាលមានគ្រួសារខ្លួនឯងក៏ដោយគាត់សប្បាយរីករាយ
Even though she was lonely and never had her own family, she enjoyed seeing other people's happiness. Being a doctor fit her inner drive, which is to sacrifice herself so that others may live.
ដើម្បីឲ្យអ្នកដទៃមានរស់រានជីវិត
Just one of more than 500,000 Americans who have died from COVID-19. One life, both ordinary and extraordinary, whose loss is being mourned and remembered. Chetra Chap for VOA News, Washington.